Welcome to the Evolution Lab. I'm Matt Roberts, and my mission here is to guide and inspire you to optimize your health, performance, and longevity so that you can live your longest, strongest life as the fittest, healthiest, and most vital version of yourself. My guest today is Sophie Medlin, a consultant dietitian specializing in the management of medical conditions such as IBS, colorectal dysfunction, and polycystic ovarian syndrome, which is why she's our go-to gut health expert at Evolution. She's chair for the British Dietetic Association, and outside of her clinical work consults on product development for the manufacture of vitamins and probiotics, most notably Heights, a brand we highly recommend. In this episode, Sophie and I discuss a range of topics including the importance of diet and stress management, the digestive process, and the impact of chronic stress on gut health. We talk about microbiome injuries, identifying and addressing digestive issues, and the impact of alcohol and processed foods on the gut itself. We also cover managing antibiotic use, dietary diversity, misconceptions about gluten, and gut health considerations for weight loss medications such as Ozempic, Mounjaro, and all the rest besides. As expected, this is a great conversation. It gives me great pleasure to present to you Sophie Medlin. So Sophie, thanks for joining me today on this episode. This is one that I'm going to find fascinating. I know it's an area I really love, and it's one that is talked about in the press constantly. In fact, my own children and my friends' children as well, they're telling these friends that all they're hearing about gut right now is have more kimchi or have more variety. Sure. And they say, is that all there is? And I say, well, no, there's a lot more than that besides as well. And I want to go through today a whole range of issues about how the gut functions, what people can think about how to improve their own digestion, how to make sure they're feeling optimized all the time. But first of all, I'd like to ask you, what drove your passion to do what you do now?
Yeah, I mean, it's an interesting question. Certainly when I was really lucky that I was 15 when I knew I wanted to be a dietitian, which is the dream, I think, because I was on a path already. But I didn't ever imagine that would mean I was going to spend my whole career talking about poo. That's not what I thought was going to happen when I was 15.
You've hit the heights, that's good.
Yeah, exactly. And I feel so lucky that I do because it's brilliant and I love it, but it wasn't kind of where I expected to be. So I then worked in the NHS. So you do, as a dietitian, you do a degree in nutrition and then you go on to learn how to apply that to medicine through dietetics. And so you got hospital placements, and I started my work in the NHS like lots of dietitians do, or most dietitians do. And then I quite quickly specialised in bowel surgery, intestinal failure, which means your bowel's not working at all and you have to be fed intravenously, and that sort of area. And the reason that I got so passionate about that is because you can make such a difference to people's quality of life. I really realised that no one was really talking about it at that time, probably 15 years ago now. No one's really talking about it. People still felt very ashamed if they had a stoma bag or they'd had bowel surgery and they were having problems. And yet some small dietary tweaks could really give them back that quality of life, get them into a much happier, healthier place and allow them to live their life like they didn't have bowel surgery. And that for me just felt so fulfilling. And then I went on and was a lecturer and researcher and did lots of different things. And I've been very fortunate that gut health has blown up in the way it has publicly because I'm very experienced in what I do and I've been doing it for a long time.
Well, you're in part responsible for that. I mean, part of the work you do actually makes that become apparent and you're stronger in the media, and these are all good positive things. And all joking aside about only being kimchi, it's really important people do understand what the gut does because, frankly, I mean, it's something that I had Dr. Gareth Morris-Stiff on recently, a liver expert, and he's saying, well, the liver is the most important thing. Of course, he said, yeah, and the stomach, or and the brain. In case, each thing's important, but actually the stomach, of course, it all starts there, and it drives all other things that we do. I think we should start with that in mind, what it does, because we probably get to let's go on a journey between mouth and exit of what the food does, where it goes, what it interacts with.
Nice.
So then get a picture of really, what's going on inside their body and why each part of that is so important and what they can think about they're doing right and wrong as we go through the rest of the session as well.
Yeah, perfect. So the first part of all eating is, in fact, even just when we smell food, so the anticipation of food, we produce saliva. And saliva contains enzymes which help to chop up different things in terms of structures of sugars or proteins, whatever it might be. Your saliva contains an enzyme called amylase, which helps to break up carbohydrates into smaller chunks of glucose molecules so that you can absorb them more effectively across the bowel wall. And essentially the whole chemical process of digestion, the whole aim of the whole thing is to chop everything up as small as possible so that it can cross your epithelial barrier and the bowel lining and into the bloodstream. So initially we have saliva, which helps to break up the carbohydrates, amylase in there. And chewing is such an important thing that I think so many people forget. So nuts is a great example of this, where if you don't chew nuts properly, you can't access all of the nutrients from them because they can't essentially be broken up any further from as they've been chewed. They'll come out pretty much exactly as they've been chewed. And so the more you chew nuts, the more calories you get, but also the more nutrients you get from them.
So on a basic level, it's a good place to start. I mean, it literally starts in the mouth. At that point, someone's chewing away, and there are various spas I know people can go to, and they've got to chew a piece of bread and milk 60 times, 100 times. It's mulchy and it's broken. Is that basically it? You're at the point where the food you're taking on board in your mouth before you swallow it has to be really pasty.
Well, I mean, ideally, from a sort of accessing all the nutrients perspective, ideally. But generally people don't do that, and that's okay. You'll still access enough of the nutrients that you need. But some things are much more difficult to digest than others, and some people have challenging digestive tracts where chewing more is going to make a massive difference to how they are going to experience that eating. And people say to me, I'm really bloated all the time. And I say, well, what are you doing at lunchtime? Well, I'm on the run and I'm shoving salad in my mouth. And I'm okay, well, that's why. It's because you're not chewing properly, you're not taking your time over food, you're probably ingesting loads of air. So there's something really important about taking your time, chewing your food properly, which also allows your hormones in your stomach that tell you when you're full to register that you're full more quickly. Whereas when we hoover things up super quickly, we don't end up having that same registration and understanding that we might actually be full.
And those hormones being ghrelin?
Ghrelin
and GLP-1?
Exactly. Yeah. So chewing is important, and if you're bloated and uncomfortable, then chew more and you might be much more comfortable. The food then travels down through our throat and down in through our esophagus. And our esophagus is actually about 9 centimetres long. It's quite a long organ, and then it travels down into our stomach. And your stomach contains stomach acid. And this is one of the most important things to talk about because people still believe that things like the alkaline diet are of relevance, when of course absolutely everything you eat turns to a very strong acid almost immediately. So your stomach acid helps to break down the food further. So it's part of this process of deconstructing things so that they're much easier to absorb. So your stomach acid starts to break down the food even further. That stomach acid also helps to kill bacteria from your mouth. And bacteria from your mouth and bacteria from the environment, bacteria that's on your food potentially, isn't really supposed to get to your gut. So your stomach acid kills that bad bacteria we don't want there, viruses, etc. But it also helps to really break down the food further and dissolve things. So for example, if you ate a raw carrot baton, it's, apart from how you've chewed it, it's going to come out in those tiny little chunks that you've chewed it in. Whereas if you have grated carrot, your stomach acid will pretty much dissolve that. So grated raw carrot, your stomach acid will pretty much dissolve and you will access all the nutrients from it, and it's much easier to digest. So your stomach acid is doing that good work. One of the things I think sometimes people think is that it sort of immediately goes from your stomach into the small bowel, when in reality your stomach can hold it maybe for an hour and a half, quite a long time, and it will very gradually squirt the fluid that's now in your stomach into the first part of the small bowel, and that's called the pyloric sphincter at the bottom of the stomach. And that's actually a very important sphincter. We don't ever think about it unless you're someone like me, but that sphincter is very important because otherwise you can get a condition called dumping syndrome, where all of your stomach contents suddenly get delivered into your small bowel, and you can get reactive hypoglycemia, so low blood sugars, and all sorts of chaos can happen. Obviously you can't absorb your food properly then either. So your pyloric sphincter very gradually squirts the food through into the very first part of your small bowel, which is called the duodenum. And that duodenum joins up with your bile duct, so with your gallbladder, and with your pancreatic enzymes. So your duodenum travels down, and we're waiting for the food to enter the small bowel, the first part of the small bowel called the jejunum. But while we're in the duodenum, bile is excreted from the gallbladder, so that's made in the liver, and it's excreted from the gallbladder into the duodenum to mix up with the food. And the higher the fat concentration in the food that you're eating, the more bile you'll release. And if you've got gallstones, which is a very common thing, then your gallbladder contracting on those stones is very, very painful. Typically that pain would be felt under the right rib, and usually as a response to eating, particularly to eating higher fat foods. So your gallbladder reads how much fat is in the system and then tells you knows how much bile to release in response to that. Your pancreas produces 3 very important digestive enzymes. It produces protease, for protein, lipase for lipids, so for fats, and amylase for carbohydrates. And those 3 digestive enzymes go in as well, so the pancreas excretes them into the digestive tract, into that duodenum part, to mix up with the food to help you to further break down all of those lipids and everything else into their smallest possible molecules for travelling across the bowel wall. Now we travel into the small bowel proper, so in the jejunum, and the jejunum is meters and meters and meters long, maybe up to 9 meters long. And that's the part of the small bowel which really primarily absorbs our nutrients. The most important bit for absorption of fats, carbohydrates, most vitamins and minerals are absorbed in the jejunum. Some are absorbed in different places. Some iron, for example, is absorbed in the stomach, but mostly our jejunum is responsible for really being that sponge that sucks all these nutrients that have been broken down into their smallest constituents into the bloodstream that lines the small bowel. And all the food will travel through. It takes its time so that everything can come into contact with the lining of the small bowel and travel through into the bloodstream. And in there we've got these billions and billions of what we call villi. They're finger-like projections that increase the surface area of the bowel millionfold, hugely, so that more and more access can be had to the contents of what you've been eating, so your body can extract the nutrients from it. We then travel through to the ileum, the second part of the small bowel, and that's primarily where things like water is absorbed and some nutrients are absorbed, but the food is travelling through and getting ready to enter the colon, the last part of the bowel. And at the very end of the ileum, there's something called the terminal ileum, which is where things like vitamin B12 are absorbed. So it's a very common place where people have it resected for things like inflammatory bowel disease, or because they have to live with an ileostomy, so a type of stoma bag. So lots and lots of my patients will be at risk or have vitamin B12 deficiency because they haven't got that bit of kit that absorbs their B12 right at the end of digestion. So the ileum, the end of the ileum, so the last part of your small bowel, is right down, we would call it your right iliac fossa, right down in your pelvis on the right hand side. And then it enters, so it goes into the large bowel at that point. And so lots of people say to me, I've got this kind of gripey lower right-hand sided pain. I think it's probably just where the food's travelling from the small bowel into the large bowel, and it's maybe a little bit tricky. We're now in the colon, and if you were inside the colon, if you imagine yourself in the colon, you look down, you're going to see the appendix. And the appendix sits right at the bottom of the colon on the right-hand side there. And that's why people who have appendicitis get that terrible right-sided pain. We haven't known for forever what the appendix does, but there's a really nice theory around now that it's like a little vial, like a little test tube of our microbiome. So when we have antibiotics, when things happen, really? We've still got a little reserve in there that releases and then reseeds our microbiome. So it's a working theory, but interesting. I love it. Now we're in the colon. So the colon is also very important for absorbing salts, so electrolytes and water. And you can live without a colon, but you also then live without a microbiome, which I think we'll probably get into in more depth later. But if we imagine that the colon is the house of the microbiome, really, it's its palace, it's where it makes all the amazing things that the microbiome is doing. But also our colon is gradually drying out the stool and moving it along through peristalsis, so squishing it along, and then it travels down, and then it exits via the rectum, sigmoid rectum, and then out through the anus. And I think we massively underestimate the colon. It's 1.5 meters long. It's a big organ. It travels all the way up in a sort of horseshoe shape from your right pelvis up under your ribs, so under your stomach, down the other side and into your left pelvis. And it's doing amazing things all the time. And we really take it for granted. And when it goes wrong, people really know it. And as the stool is trying to exit, I deal with lots and lots of patients who have rectal dysfunction, which is linked to pelvic floor dysfunction often. So it could be perimenopausal women, postmenopausal women, it could be after a complex childbirth, but lots and lots of people struggle to have what I would call a complete evacuation. So they go to the loo and they just realise that there's still something there and they can't quite clear it. Constipation is, of course, a really common thing as well. So there's lots of things that go wrong in that rectal anal department that, you know, we work on all the time in clinic to support people to get the stool the right consistency to make it as easy as possible for them to be as comfortable and not be thinking about going for a poo all day.
It's really clear explanation of the whole process, and it's so complicated in terms of what we actually do on a just day-to-day basis within that. We'll come back to the menopausal, perimenopausal, postmenopausal females, because it's quite a key area to look into for sure. Going back up the chain a bit, the bits of that, I guess, can form some dysfunction initially are pancreatic, liver, gallbladder.
Yep.
How would someone know symptomatically they've got a problem, because they might feel as though they've got something going on which is clearly digestively not quite right. Whether that's exhibiting as being diarrhea, bloating, gas, whether that's just a churny feeling, some pain. Symptomatically, they're thinking, and this is all going on, or I just feel a bit tired. Can they sort of self-diagnose at the first instance to say, it's my liver, but then I drink, 10 units a day. So it's a case of looking at things which are obvious. You say, yeah, well, it's your liver because we're showing things in your stool. It's your pancreas because we know it might be that. Are there things we can look at and say, actually, I should cut back on this, I should add these things in, based on that first phase of the digestive processes?
Yeah, good question. I think one of the really important things to say in this is that if there's something wrong with your pancreas, so I'm going to describe some symptoms in a minute. If you're exhibiting any of those symptoms, you can't take a gamble with your pancreas. So if you think, that sounds a bit like what's going on for me, make sure you go to the doctor. You can have a test called a fecal elastase test, which checks your pancreatic function. But also if you feel like there might be something wrong with your pancreas, because unfortunately, rates of death from pancreatic cancer are so high, we have to just make sure that, you can't say...
It's a real go-to straight away. Yeah, don't pass go straight to it.
Never, and don't just think, I'll just take some digestive enzymes and I'll be all right. Go and get it checked out.
Often confused as being gallbladder issues rather than pancreatic, isn't it?
Yeah. So the gallbladder sits pretty much in the same place as the pancreas in terms of where it excretes into. And we talked about gallstones earlier. So gallstones are really painful stones that sit in the gallbladder, which can be formed from diet and lifestyle. Often there's a genetic element there as well. So sometimes people who have a less favourable diet may be more at risk of gallstones, but you're also at higher risk of gallstones if you've lost a lot of weight, if you have had certain types of bowel surgery. So there's lots of reasons why you might be at risk of gallstones, which is nothing to do with the way that you've eaten or not looked after yourself or have looked after yourself. If you have gallstones, you'll notice that very distinct pain under the right rib, immediately, usually associated with eating. So after eating or during eating, that pain would come on, and you could test it, and you might say it's noticeably worse when I have higher fat foods, and then you would know for sure that it's most likely to be gallstones. In which case you want to get that scanned.
And that differs from the pancreatic side, as in the pancreatic's more ongoing pain, or it's just,
I mean, pancreatitis is incredibly painful.
Yeah.
Like, go to hospital immediately. Gallstones can be as well.
And you see, of course, in both cases where it can be jaundice setting in as well, and extreme cases of these things too.
Yeah, and the digestive symptoms of something not being quite right with either your gallbladder or your pancreas, bear in mind that the pancreas produces lipase, which also helps to digest fat like the gallbladder does, or bile does from the gallbladder. What you can expect then is that you would have oily stools. So you'd be malabsorbing fat. And what that would manifest as is, if you imagine this is not a very pleasant thought, but if you imagine your rectum was full of lubricant, like fat, which it is in this case, then you're going to have to really rush the toilet, because you're going to really struggle to hold those stools when everything's very lubricated with oils inside the rectum. So urgency, we would call it, rushing to the toilet. Those stools are going to be really foul smelling, often very pale in colour, or a very different colour to what you're used to. And they're going to probably float, but definitely leave like an oily residue in the toilet pan afterwards. The other question I would ask people is, does it feel greasy when you're wiping? And that can be another sign that there might be some oil in the stool. My message there is really to say, unless you have those things going on, or you have lots of pain, it's very unlikely to be your pancreas or your gallbladder that's causing those problems. And there's a very careful history that I take as part of my consultations where I can understand how likely it is that that's happening or not for people.
Right, got it. Interesting, fascinating. So someone's got pain being exhibited. Certainly it's go to the GP straight away, isn't it, really, basically?
Yeah.
And looking at the stool, sampling yourself and taking an assessment on that. If there's no pain involved, you look at that, I think, well, I'm probably okay, watch it for X period of time.
Yeah.
And fine. If someone's got a liver that's dysfunctional, is there a difference in what they're exhibiting then within how they're experiencing pain or bloating or stool samples?
Fairly similar often, but with liver problems, often you can be much more distended, we would call it. So you can have a lot of fluid accumulating on the abdomen. Your stools can change colour, be more pale and funny yellow colour because of the jaundice that can happen. There's lots of unusual things that can occur when you have liver dysfunction. And I think, a lot of people do live with low-level liver dysfunction. For example, fatty liver, non-alcoholic fatty liver, alcoholic fatty liver, where it's just starting to not be able to compensate for the lifestyle factors that we are putting it under. And that can then, as you say, result in some bloating, discomfort, and sometimes a change in the stool consistency and colour, but not usually until that liver dysfunction is much further down the line.
Yeah, so someone gets to that point where they have got some fatty liver build-up and some fibrosis being developed. from your perspective, looking at then people's microbiome and their gut sampling, are you seeing, what do you see as being the obvious things that change within that? Is it a change in their speed of digestion? Is it a change in, again, the stool that they're getting out of their system? What changes there, and at what point are you concerned about that? Have to refer them on further for, you have to now go and check in with a different consultant specialist?
So if I thought there was a liver involvement, I would always recommend they see a hepatologist or a liver doctor, because there's nothing I can do to support your liver once it's gone that far. Hopefully we're at a stage where we can still make some positive changes to reverse the fatty liver, or at least stabilize it, and we can do that through diet and lifestyle. But there's nothing I can do to medically fix that problem, and we need to monitor it. It needs to be very carefully looked after. From a stools perspective, you may see looser stools, you may see a bit of urgency, depending on what's going on with the gallbladder function and the production of bile and other things. But ultimately, it's not going to necessarily be the first thing that I'm thinking about in terms of people's digestion.
Going further down the chain to get the stomach then. And in terms of the role of dysfunction of the liver and the pancreas and then down to the gut itself, let's go through what happens when that's all happening and people's impact on their hormones and hormone release and general mood, because anxiety and depression are obviously strongly linked into what our gut is doing. Is that coming from dysfunction within the pancreas and the liver, or is that further down to the gut itself? Where does that come from? Because serotonin is produced from the gut and with the brain as well, clearly. But what happens to actually get to the point where there's this disconnection between what the gut is doing correctly? The gut really drives what the brain does rather than reverse, doesn't it?
Absolutely. Yeah.
So where does it go wrong? What's the point at which the hormones get disturbed by gut function failing?
So the gut and the brain are connected in 3 different ways. So they're connected hormonally via the HPA axis, so hippocampus, pituitary, and adrenal axis. And that's largely looked after by gut bacteria in terms of how much cortisol we release, for example, in response to stress and anxiety, how much of other hormones we're releasing because our body's reading that something's not right at the moment. And our gut bacteria control a lot of that and create even like a set point for cortisol. So you and I will release different amounts of cortisol in response to a problem. And the amount of cortisol we release will affect our quality of life to a large extent, because we all know the people who jump at the very first noise that is behind them or anything like that. That's quite a debilitating way to live, actually, that level of responsiveness. Whereas if our gut bacteria are working favourably for us, it can bring down that cortisol reaction to things and we release less cortisol. So we go, oh, that was a noise behind me, rather than jumping out of our skins and being terrified. So our gut bacteria are interacting that way, which is pretty magic. And that's largely these gut bacteria that live in our colon. Those gut bacteria that live in our colon will be affected by things going wrong with our pancreas, with our liver, and with our gallbladder. So and equally, if you have too much or too little stomach acid, and many people are on stomach acid suppressing medications, omeprazole and things like that, that's going to affect your gut bacteria and can set any of these kind of axes off into the wrong direction. So it's connected hormonally, it's connected physically by the vagus nerve. And again, if you have pain from your gallbladder, that's going to be sending loads of signals up to your brain. If you have pain because you're constipated or bloated, that's going to be sending lots and lots of signals up to the brain. So they're hormonally connected, physically connected, and chemically connected via neurotransmitters, as you mentioned. So the gut bacteria and the gut itself produce serotonin. We don't understand at the moment how much of that serotonin translates into brain serotonin. But the fact that our gut and our brain share such an important neurotransmitter is a very interesting thing, and something that people are working very hard on, probably as we speak, to try and unpack. Our gut bacteria do produce some other neurotransmitters, things like GABA. GABA is the neurotransmitter that you really want to have when you've had a stressful day. It latches onto those it's a very basic way of explaining it. It latches onto the cortisol receptors and switches them off. So there's something there already. So the cortisol can't access your brain, and the GABA helps you to relax and unwind. It won't allow that to affect you in the same way anymore. And I think, again, I certainly work with lots of patients and I think, I feel like you've got a big GABA deficiency, because you can never switch off from the stress and anxiety that you're experiencing.
But that's where, obviously, people have sleep issues. This is all linked to that same network. The serotonin, melatonin association is quite distinct. And with that melatonin being produced and serotonin not being present to allow that to happen, means you can't fall asleep as readily. The GABA to actually be able to be more chilled and get to sleep is a big deal. So if someone's missing sleep, there's this kind of horrible cycle downwards, isn't there, where you miss sleep, you feel more anxious because you've missed out sleep, your gut gets affected by that, You can't produce as much as you need to on the serotonin side, so you get less sleep the next night, and it goes down and down and down and down.
Totally.
And breaking the cycle is a big deal.
Yeah.
And that vagus nerve, let's go back to that, because the vagus nerve, it's something which is, it's not to do with gambling. This is all about, it's that link between, gut and brain. It's the hardwire nerve, isn't it? That actually, it tells the brain what to do and vice versa. You've got that link that's there.
Yeah.
And it can be calmed. It can be relaxed.
Yeah.
And that parasympathetic and sympathetic nervous system, which exists, it's crucial to understand how people can make that become calmed and be settled, because we need to do a few things. We've got to make sure that there's this heart rate variability, the HRV, which when you've got these tracking devices on, we manically watch all the time, but they're quite critical numbers to see how much someone's system is being overstressed. And the whole notion of, people talk about a gut feeling. A gut feeling is there for a reason. It's there, you get a response to a stress. And your point you made earlier about just people's stresses, the question I would ask actually as well in this zone is really, if someone has a day of stress and they've been late for work and they've run for the bus and they've got to load on their workload and they've got that going on, they're going to feel digestively, probably exhibit digestively some problems and symptoms.
Very likely, yeah.
But then day by day by day, and after a week and a month and a year and 2 years, and that perpetual stress, what are the long-term effects of that perpetual stress with that in mind on that gut function?
Yeah. Well, I see a lot of patients for what I would call a stress-related microbiome injury. And what I mean by that is that very acute, even if it's an acute, so say a bereavement, for example, you're going to feel terrible, very, very terrible initially. You have to deal with the funeral, all of those kinds of things. And then you're going to feel less terrible over time, but you're still going to feel pretty terrible. So that might be an acute trauma that creates a lot of differences in digestion that affect your microbiome. Equally, it might be long-term, low-level stress, anxiety, elderly parents to look after, high-pressure job, maybe some toddlers in the house, these sorts of things that just create this constant low-level pressure, anxiety. And either of those scenarios can cause a microbiome injury, as I would term it. And that, what I mean by that is that changes to your digestion as a result of the stress has a physical impact on our digestion. For example, it speeds things up, so more substrate is delivered to the colon, where bacteria can have a field day, good and bad. We also know that stomach acid increases, and that changes the pH of the gut. And so if you remember from like GCSE biology, pH has a big impact on which bacteria can live where. And so ultimately, if we change the pH of the gut through chronic stress, we can end up in a situation where we have much more unfavorable bacteria and much less of the good guys that are doing good things for us. And I like to think of this as like evolution in action. So what I mean by that is that your gut bacteria daily are adapting to what you're doing. And your gut bacteria in a situation of chronic stress have read that there is a lot of stress around. And they're going, all right, guys, we're going to perpetuate that stress. So we're going to make things worse because we think we need to be on this high alert all the time. We're going to increase that cortisol response. We're going to do all these things that are going to perpetuate that stress and anxiety. And I think one of the really important parts of this conversation is to say, we all know about fight or flight, but we don't often talk about the opposite of that, which is rest and digest. And there's a reason why digest is in that sentence.
No, it's exactly right. And I think that it's worth thinking about the timelines, because people suffer with stress on a daily basis, and they have stress they carry for various reasons. I mean, at this point of talking today, there are factual stresses in people's lives because of changes in budgets and wherever else is going in life, and the world full stop. And that's fine for a week or a month, but ongoing stress is quite common. People do sit in jobs that are tough, and parents look after who are elderly, and children aren't just for Christmas, they're there for a long time, and there's lots to work with all the time. So this ongoing year by year by year impact is significant.
Yeah.
So from your clinical perspective, when someone comes to you, I guess part of your role isn't just what you can eat, but it's partially the sort of counselling role as well, to understand how to try and get to that calm point.
Yeah.
Are you sort of almost prescribing people to do meditation work?
Yeah, absolutely.
Are you really?
Yeah, absolutely. So in the NICE guidelines, so the National Institute of Clinical Excellence, who release guidelines on things like irritable bowel syndrome, as in this example, hypnotherapy, gut-directed hypnotherapy is in the NICE guidelines for the treatment of irritable bowel syndrome.
I didn't know, that's amazing.
Yeah. So there is amazing gut-directed hypnotherapy apps you can use. There are downloads that you can use that tell your mind to calm down, and that will help your gut to calm down. And it's not, I think sometimes when we have this conversation, people think I'm saying it's all in your head, and I'm absolutely not. But what I am saying is that our stress causes physical changes to the body that are unfavourable to us. So hypnotherapy, gut-directed hypnotherapy is amazing. Meditation is amazing. We also recommend gut-directed yoga, which is particular positions that help to support the gut. Breath work is super helpful for the gut-brain axis and for helping people to calm down. And I often think breath work is actually maybe a little bit more accessible to people on the go, on the train, maybe at different places where they can just take a moment to breathe properly, and that can really help to calm everything down. And that deep breath work gets us out of the fight or flight part of our nervous system and into that rest and digest part. So breath work is a super important thing for helping us to stay calm, taking care of our gut bacteria. And you're absolutely right. I ask every patient about stress, and then I'll ask them, what's in your stress management toolkit? What do you do to help calm down? 90% of people say, nothing. I don't do anything at the moment. And it can be hard. And I would say as well, I might see a patient for 3 sessions and we're not making much progress, and for example with IBS, and then we have to accept that it's probably much more driven by their nervous system than it is driven by what they're eating. And that can sometimes be quite a difficult conversation to say, actually I think I need to refer you to my colleagues who specialise in the gut-brain connection and psychological techniques to help you with this, because I don't think we can make much of a difference here. And I would usually know those patients within the first 10 minutes of the appointment because they're the most stressed and anxious and
they're exhibiting
people.
signs of being agitated.
Yeah, totally. Yeah.
It's really fascinating. And we know that breath work does a huge amount, and we're now at a point where it's crossed that line between being, it's a bit weird and hocus pocus, but it's being used now mainstream with athletes, sports people, business leaders, and it's now a known thing. It's not laughed at anymore. And I laughed about your point you raised about doing gut-based yoga at a spa in India I go to occasionally.
Nice.
I go and do a gut-based evacuation around yoga.
Nice.
And when I first did it, I thought, what? And it's 8 poses of yoga combined with drinking slightly salinated warm water. So you drink half a litre, like a drinking game. You drink half a litre and then you do 8 poses and drink half a litre until the inevitable happens. And it's out there and wild. But I have to say, it's a remarkable way to actually just re-educate and reset your gut, and it's right there. And these things are ancient. This is based on Ayurvedic medicine, it's on yoga therapy, it's been there for years and years. We know all that stuff, and when you actually do it, there's a great place to be reached with it. But it's all really linked into making your nervous system be allowed to find a place that's calm. And we know things, from my point of view, from an exercise perspective, produce some calm. Being aerobically healthy and well, having strong musculature helps to make sure you create a sense of well-being, and it's all good. But ultimately, it is about not disturbing the ability to switch off. So which things do we know are bad? So if you look at the things that are obvious, disturb someone's ability to recover, alcohol is high on the list. So you must see people coming in, and you know that the first thing to try and deal with in reality, if you just cut down the alcohol, or cut it out, then that gut process, that brain process, that nerve process must improve. So confronting that conversation must be difficult.
It's difficult. It can be difficult. I would say, obviously I ask about alcohol when I'm talking about what people eat and drink in the day. It's an important part of the consultation. Alcohol speeds things up in your digestive tract. Your gut bacteria do not like alcohol. Alcohol makes you more anxious the next day. It probably makes you eat more the next day. It affects our appetite hormones. And there are so many things that alcohol is doing that are negative for us. But it's such an intrinsic part of our culture. People find it incredibly difficult to think about letting go of that as part of their lifestyle, as their social life. And I think it really is about, as with most dietary things, it's largely about trying to manage what you do in the house, and then the things that you do occasionally outside the house, enjoy yourself and have a nice time. But if it's an everyday thing, that's when it's really time to knuckle down on that drinking.
So I'm going to pin out some numbers in this one. So Dr. Morris Stiff, his point with the liver in mind was that people having one drink regularly was better for the liver than having a binge, of course, naturally.
I guess I'm talking about people drinking half a bottle
Absolutely, exactly right. So there's the quantity that's involved in that.
Yeah.
If you had to say to someone, people listen to this thinking, I can't not drink alcohol, is there a level at which there's no impact to the gut? Does one drink cause impact?
Yeah, so what we think is that red wine, which contains loads of polyphenols, likely has some benefit to our gut bacteria. So one small glass of red wine in the evening, one of those small French wine glasses, not the
old-fashioned, real small ones,
could potentially be of benefit. But it's very quick for that to then tip into the harm. So it doesn't sort of go benefit, 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 harm, 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 all the way over here. It goes very quickly from benefit to harm.
Yeah.
And so we have to really be conscious about the volume and the amount of alcohol that we're consuming.
So in the course of a week, it's really about it's less than 10 units per week for sure, probably 6 or 7 in reality.
Yeah.
Small quantities.
You know, I really would like it if my patients could say, oh, do you know what, I often go a week or two without drinking. I just don't really think about it, and then I'll go out for dinner and I might have a glass of wine. To me, that feels like a very healthy relationship with alcohol.
Does that sound like a place people get to infrequently though, and in reality they're drinking increasingly more often?
I think it's a mixture. I think some people are much more socially dependent on alcohol than other people are. Of course, there's different cultural aspects that come into this as well. But I think ultimately we generally take after, like, mirror our parents' drinking habits. And so sometimes that can be something that we need to reflect on about whether it's healthy for us at that time.
Yeah, for sure. Just going back to some of the things that disturb the gut. I mean, one thing that springs to mind with that question is the increased amounts of medications over a long period of time that have been building up, and specifically, probably really antibiotics, because there's obviously a high prevalence of that being used, those being used in various types. And whilst there's always a thing of, well, this one won't affect your gut, it's specific for X. In reality, it all goes via the gut.
Yeah.
So if someone's being given a course of a 5-day course of antibiotics, whichever one they might be, rifaximin, anything at all. They're given that, and they had the benefit of hopefully taking that. The thing they're doing with goes away. What's the impact, though, from your point of view, on that one short course? Is it nothing? Is it tiny? Is it not to worry about, and then it'll just reestablish itself?
Yeah, I mean, we don't know for sure, but certain antibiotics do have more of an impact than others on the gut microbiome. And I see plenty of people in clinic with what I would call an antibiotic-related microbiome injury. And most commonly, those are people who have had to take antibiotics or been told to take antibiotics for a protracted period of time. Teenagers with skin problems are often put on antibiotics almost indefinitely. People who have recurrent urinary tract infections. Sometimes people who even have infections in the gut known as diverticulitis, which is a very common condition. They're given more and more antibiotics to try and keep on top of the infection, but those antibiotics are driving the microbiome into a pro-inflammatory state and causing more problems in the long run. So for me, if you're having a short course of antibiotics, just take some probiotics immediately afterwards and you'll probably be okay. If you know that you're someone who's going to have cyclical antibiotics or regular antibiotics, or you have done in the past and you notice your gut function is changing, it's very likely there's a change to the microbiome that's unfavourable to you, which, to reassure anyone, is completely reversible. And often when we do reverse the damage to the microbiome, whatever it was they were taking the antibiotics for gets better as well. So ultimately we can try and work things out that way.
I'm going to shamelessly plug the probiotic that you developed and designed with Heights. And I'm not linked to Heights. I just think it's a really, really, really good product you created for them.
Thank you.
And without actually having any sort of gut issue going into trying them for the first time some time ago, I was staggered by how much better I felt by taking them. And it's just something which, without any apparent issues, it was still, that's really good. Yeah. So anyone listening to this, I'm not on commission for this, they're a really great product. I love them. They're really terrific.
Thank you.
For someone who's been on a long-term course of antibiotics, dealing with whatever they're dealing with, whether that be skin or anything else, months of taking them, high dose maybe, at what point does that become then long-term problematic? Is it always reversible?
I mean, almost always reversible. We seem to be able to, the microbiome changes every day. It changes when you go to sleep and changes when you wake up. So it's very reversible. For people, in my experience, people who've had a protracted problem with symptoms, I might see people who've had a problem for 20 years. That problem is going to take a lot longer to reverse than someone who comes to me and says, I've had it for 5 months. Within that 5 months, the microbiome is still re-establishing in this new form. We can make it much easier to reverse that much more quickly than someone who is really set in, and that microbiome will be very well established in the form it's in that's not favourable to them.
So if someone's been on this sort of journey taking lots of antibiotics and they're wondering how to try and re-establish, back to a conversation at the start about kimchi and live food and so on, what do you do? What's the go-to plan to make sure you can get the gut to re-establish gradually? Yeah,
so it kind of depends on what symptoms they're living with. So if they've had long-term antibiotics, they've got what I would call a microbiome injury, their bowel is not behaving as they want it to, maybe they've got diarrhea, maybe they're really constipated, wind, bloating, etc. We're going to have to find those food triggers first of all and get that gut to calm down. And often those are fermentable carbohydrates, things that are found in things like onion and garlic and apples and everywhere in the diet.
They're causing the issue, they're the culprits.
What happens with, they're called FODMAPs as a kind of family. when we consume high FODMAP foods, they travel through the gut and then they're really rapidly fermented by bacteria, especially where there's an imbalance of bacteria. So they're really rapidly fermented and lots of water's drawn into the bowel. And for some people, that gas producing process can slow the colon down, and for other people it just makes everything rush out too quickly. And so what we would want to do is find those trigger foods first of all, so that we can reduce the symptoms that they're living with day to day, which is going to calm their mind down and make them feel more relaxed. And at the same time, we'll use some probiotics. We may even use some prebiotics, so some food for the good bacteria that's also non-fermenting, and try and feed them and
What
seed
kind of
them.
things? What sort of thing would be?
So there's a particular product, I don't know how to name it because the company's a bit dodge. So things like oat bran fibre is really good for feeding good bacteria. So there's lots of things that we can introduce that will feed good bacteria but don't ferment in the gut. And so we would give people things like that to try and feed the good bacteria while trying to give some more good bacteria and calm down those symptoms so their gut-brain axis is more relaxed and things can be better. Then we do a long reintroducing process. And lots of my patients who have a microbiome injury may have cut out dairy for a long time, they might have cut out gluten for a long time, they might have cut out lots and lots of things from their diet, which inevitably is going to make the problem worse in the long run, because ultimately the less we feed our good bacteria, the less familiar they are with those foods and they struggle to digest them the next time. It's a very simplistic way of explaining it. But
this is the problem a bit, isn't it, with sort of FODMAP eating, the
Yeah.
FODMAP diet, is you're obviously taking away so many
Yeah.
foods and restricting, then you create a problem potentially with not being able to readjust when you're introducing back in again.
And that's where working with a dietitian is so crucial, because you've got to do that gradual reintroduction process, reassess, and you need to be investing in your microbiome from day one of starting that through probiotics and prebiotics.
Someone listening to that, then if someone goes on to, they've got a gut issue, they're trying to get over it and reestablish, they're following a FODMAP diet to try and restrict and then rebuild. What's the timeline? Someone's got in their mind, it's going to take me a week, is it 2 weeks?
Yeah.
It's a lot longer than that.
We're
What's
talking
the timeline?
about potentially 3 months until you're at a point where you're like, I know these are my triggers. I couldn't give you an end point at which time your microbiome is going to be reestablished. It could take another 3 months. It could take another year after that. Again, it all depends on how long that sort of damage to the microbiome has been set in for, really. But I think when we talk about these things, it's really important to talk about the people who don't have gut symptoms as well, people who just want to optimize their gut health. And as you say, Tim Spector, other people are talking really about including as many plants as possible in your diet. And that's absolutely the right thing to do. So it's about variety, which as a dietitian I know all too well, most people in the UK are living off broccoli, carrots, sometimes green beans, and for a salad, they have lettuce, tomatoes, and cucumber, and maybe peppers if you're lucky. And there's sort of maybe 10 vegetables. And fruits-wise, it'll be apples, it might be pears, it's likely to be oranges. There are a few fruits and vegetables that people eat on repeat. And ideally what we want to be doing is really getting that good dietary variety in. So different plants, because different plants feed different good bacteria, which then have beneficial effects for us. If we just feed a few, we get a much less diverse microbiome. If we feed lots of different things, then we get a much more diverse microbiome. And the same applies for grains. So we're very reliant in this country on oats and wheat, but there are a plethora of other grains we could be consuming that would be doing a great job to support our microbiome. Nuts and seeds count, herbs and spices count. So any plants you can imagine, add them into your diet in any way that you can. And a sort of practical tip might be to use one of the vegetable delivery boxes, the seasonal vegetable delivery boxes, or and veg and fruit potentially, because then you're getting things that you don't normally have, and you have to figure out how to use them, even if you're just chucking them in a soup every week.
It's a good idea, and that's great. When we spoke a long time ago about this, originally actually with Nicola, a dietitian, and we discussed, and I discussed with Tim Spector as well, the number of different plant types to consume per week, and I thought, check it out in a kind of really ridiculous way. So I counted what I was having in a week, and it was actually okay. It was up around sort of 36 types per week, and fine. I think in America, the average is around 15 or 20 types of different plant per week. In parts of Africa, there are still tribes who have hundreds of types per week, and very few symptoms of gut problems and diabetes and so on with it as well. So that diversity is really critical for good gut health, isn't it?
Absolutely. Yeah. And it's just about trying to, and it's hard for people because we're all in our habits, we're on our train tracks, we're going to work, we're doing our things, we do our food shopping. We want to buy the same things because we know we're going to eat them, the family's going to eat them, everyone likes them. But actually just trying to diversify a little bit can make a huge difference. Another great tip is instead of buying blueberries, buy a bag of frozen mixed berries, and then you're getting loads of extra plant points when you have your porridge in the morning.
Are we fundamentally just kind of really low on fibre as well in a diet? Is that one of the key things that's missing?
Certainly, yeah, absolutely. So I think on average people consume around 15 grams of fibre, but we need 30 grams a day. So we're really low on fibre. And fibre is not just great for our gut, it also helps to keep us full for longer and helps to sweep cholesterol out of our gut and does loads of amazing things for us. So ultimately, having more fibre in the diet, including more plants, having more whole grains, is going to help you to stay fuller, regulate your appetite, regulate your weight, support your gut health, and do loads of really helpful things for you around that.
There's lots of discussion always in the media again about someone getting leaky gut. And no one ever says about leaky gut, but no one's quite sure what it is. And one thing that Dr. Stephen Gundry advocates is having no gluten, having no chia seeds, because they're going to give you some holes in the gut lining and so on. What's the truth on this?
Yeah, I mean, so from a scientific and medical perspective, leaky gut isn't a diagnosis that we would make. And please nobody worry about getting chia seeds stuck in your gut wall. I've seen, I'm in no way a histologist who looks at slides, plates of people's bowel walls under a microscope, but I've seen thousands of them. No one's got chia seeds stuck in their bowel wall. Even people with the most
What about
extreme
gluten?
problems.
Gluten's given obviously tons of bad press.
Yeah. So gluten in people who have celiac disease, which is actually quite a difficult thing to diagnose. So there is lots and lots of people out there living with undiagnosed celiac disease, despite having bowel symptoms and potentially going to the doctor quite a lot about it.
Symptomatically appearing as what?
Mostly diarrhea, weight loss, anemia, often bone thinning if it's gone on for a long time as well. So people who have celiac disease are essentially allergic to gluten, but it's not an allergic reaction. It triggers an autoimmune reaction where the gut tissues attack themselves and then you can't absorb things anymore. Those villi I talked about earlier all slough off and the bowel wall becomes smooth, so you can't absorb the nutrients from your diet, and that then leads to diarrhea and vitamin deficiencies essentially. Those people excluded mostly from this conversation, in that they absolutely have to never eat gluten for the rest of their lives, because otherwise they will trigger this autoimmune reaction that can be harmful and fatal. So other people, we'd certainly know that lots of people have non-celiac gluten sensitivity, where they're not reacting to gluten in the way that a celiac person is, but they are having sensitivity when they consume gluten, and that's largely a microbiome problem. And when we cut things out, we end up in a situation where we aren't very tolerant to it anymore, because our body's not used to being, gut bacteria specifically, are not used to being presented with it anymore. So it's fermented and then causes more problems for people. So I think if you cut things out of your diet, you are likely in the long run to become less tolerant to them when you consume smaller amounts of them. And gluten is not causing anyone any physical harm. It can cause nasty symptoms for some people, but it's not causing you physical harm. And I think we need to try and calm everyone down about gluten, because it's just this funny little protein that's in bread that people have, or wheat specifically, that people have got very cross with.
Any truth in the idea, because again it's put out there, about the change in our sort of indigenous wheat type we have here to the change that was made some years ago, and that having an issue of a different type of gluten affecting the body? Is that true or just rubbish?
Listen, we have certainly intensively farmed wheat to a point where it's, it produces so much yield, and it's not a very natural, original part of wheat. But I'm not concerned about it causing people physical harm. And I can't speak to the farming practices in America where things may be done differently, and I think it might be dangers that I don't know about over there. But certainly here, wheat is fairly inert, and I don't think we need to worry about it massively. Does it contain all of the beneficial nutrients that it might have done before we really intensively farmed? Maybe not. That's another conversation.
That's different again. Yeah, that's right. Yeah. Okay. With the whole process in mind, and going back to the kind of the point you made about the bowel and the slowing of the bowel, at the moment, of course, there's a big increase in GLP-1 activators. So the things which are the Wegovy and Mounjaro and all the Ozempic and all the iterations of it, which whilst they're great on a level, I think everyone I've spoken to in this podcast series, we've discussed this area at length. They're great on a level, and they produce for some people some great weight loss, and that's fine. There are issues I have with the type of weight loss it causes unless it's really controlled by the appropriate exercise, dietary control. From a stomach and bowel perspective, what damage is that causing if it's used for a short period? Someone used it for 3 months, or then 12, or then 24. What's the level of damage it might be causing long term?
Well, it's a new medication. So there are things we know and there are things we don't know. What we do know is it really slows down digestion. So most people will be constipated when they're using these kinds of medications, which some people tolerate okay and some people find unbearable. The other problem with them is that we're noticing that there is an association with pancreatitis. And pancreatitis, we talked about it briefly earlier, is inflammation or infection within the pancreas itself, which is not uncommonly life-threatening. And so it's something, it's incredibly painful, but it's life-threatening in some cases. And I've been speaking to A&E doctors and things like that who are saying every week they're getting people on these weight loss medications coming into hospital with pancreatitis and other side effects. And that really
So we're now
worries
probably
me.
3 years into this, I would say, in terms of it being available in the UK.
Yeah, but we're not 3 years into it being so publicly available, I would say.
No.
So anybody can go online and lie about their BMI and doctor some pictures and make themselves look a bit bigger and get these kinds of medications. There's not good checks in place to protect people from that.
Is that overprescribing in terms of the dosages? I know someone recently, a journalist I spoke to recently, and she came in and I think it was on Manjaro she was being given, and she was being given 3 times the start level from day one. Felt dreadful for 2 weeks and then was wondering what the hell was going on. Took her off that clearly, got into a workout routine and diet routine. And she's great and having a great time and in great form right now. But that's happening a lot because it's an off-label usage right now. It's on-label usages for diabetes. And to be clear what it does, it's GLP-1 activates. So it makes that hormone in your gut you referred to earlier, stimulates that so you feel like you're full, can't eat more food, slows down the intake, and therefore you're eating less, you lose weight.
Yeah, and you don't want to eat anything. The problems that we're seeing, so I think we need to really highlight the fact that lots of people are getting their hands on this medication who don't need to lose weight, who are already a healthy weight but want to be thinner. And they can even buy that now from your friendly local drug dealer who are stocking these kinds of things. Apparently hairdressers have got bootloads of it. There's all sorts of things that you can do now to get hold of it in a way that is really unsafe and that potentially brings a lot of shame as well, because if people are probably hiding it from their families and pretending they're not taking it because people will be worried about them because they know they don't need to be any thinner than they are already, and that's a real worry for people. What I'm seeing a lot in clinic is people who are on them are just not eating very well at all. To speak to this point that you made, Matt, about unhealthy weight loss, they're maybe just eating a packet of crisps in the afternoon because they don't fancy anything else, and then they might have a few mouthfuls of dinner and that's it. So from a nutritional deficiencies perspective, they're at huge risk. And they're also going to have other digestive issues as a result of that. But also people are very scared of getting off it. So people are worried, when do I stop and how do I stop? And if I stop, I'm going to regain all the weight. I think that those are conversations that aren't being had, particularly when people are purchasing it from an online retailer or online pharmacy. No one's supporting them through that journey. No one's telling them you really need to exercise or you're going to lose all your muscles. No one's telling them you have to eat a balanced diet, otherwise you're going to end up with nutritional deficiencies. And also no one's telling them you're going to take this for 3 months, 6 months, and then you're going to come off it, and this is how that's going to work, and this is how you're going to feel, and this is how you're going to get through that point where your appetite returns and suddenly you want to eat everything again.
The issues with this, at the time we're recording this today now, there's a plan by the current health minister, Wes Streeting, to allow people who are not working to take these sort of drugs to lose some weight to get back to work again. What you're doing, I think, of course, really is you're storing up an issue for later on. And we know as well, those people who are taking, I think it's a study out of Wisconsin University, those people taking these medications are less inclined to exercise because they have less energy. And therefore you're making the muscle mass reduce. You're storing up issues for later on, whether that be bone density, whether that be energy, structural changes and issues, injuries in the body, full stop. So back to work is not going to happen. Either lose some weight for a bit and then either regain it or get less mobile over time. But alongside that, make their gut become less active. Disturb the microbiome?
Potentially, yeah, for sure, yeah.
So a whole range of issues that are there being stored for the future, for sure.
And also I think, we still need to speak to the point that most people regain the weight they've lost. And that's sad, but it's true, even using these medications, And say you lose a load of weight and go back to work, but then you just gradually regain it because you're back in that exact same environment where you gained the weight in the first place.
There are things that act a bit like the drugs. Things like yerba mate is a kind of a more natural way to take on something that's like a GLP-1 activator, I think, isn't it? Berberine? Effective?
Potentially. It's early days with berberine and it's only recently become a bit more buzzy, in terms of potentially even some potentially even some benefits to blood glucose regulation, which of course is really positive and very out there now as a message. You know, I just don't think any of these things are going to solve an underlying problem that people are struggling with their relationship with food, and that they need some support with managing their appetite. And managing appetite is about thinking about what you're eating and when you're eating, and not restricting too much, and making sure that you're eating the right types of things at the right time. And it's not impossible to regulate your appetite through very natural means. One of the things that concerns me is I see lots of patients who come to me for weight management, for example, and we'll talk about what they're eating. And they're not overeating, they're not doing anything wildly wrong. And there isn't an issue with appetite regulation. They're not gaining weight because their appetite isn't regulated. Usually it's because of emotional eating. And taking away that emotional crutch by making them not hungry all the time can cause all kinds of psychological problems to people. We have to replace the crutch and then help them in other ways.
It's a really, really key point, actually. It's something that there's such a reliance on, you know, how the thought of the eating, the planning of the eating, same relationship with alcohol as well, where it causes all sorts of ongoing issues down the line. I guess people listening to this will relate to their own needs, of course, naturally. I think that for most people, I think most girls listening, perhaps in their teens and 20s, my daughter is 22 years old. She definitely has an interest in just being as well as possible, being healthy and fine, make the gut work well, and there are ebbs and flows to all those things. What are the things that people need to think about if it's that female who's in their 20s, teens and 20s, about quantity of food they should be thinking of eating rather than reducing food down? So you always go to lose some weight. How do they think about their diet? And if they have got a short-term blip where suddenly, God, I'm bloated, I can't get in that dress, what is a maybe quick go-to? What can they do within this 24-hour period for that thing they're going to the next day? Are there ways to try and fix these things in the short term?
Yeah, good question. So peppermint tea and peppermint oil, for example, helps to smooth the transit of food through the bowel. So it calms the bowel down and makes it a bit more lubricated and slippery and a bit easier for things to travel through. So peppermint tea is really useful. If you're having tummy cramps and discomfort, then Buscopan, which you can buy over the counter, is a really useful thing. Again, it relaxes the gut and helps you to feel less uncomfortable. There are things like Windy's tablets that help to release gas so that you feel less bloated and uncomfortable.
Any downsides of that kind of thing at all? There are issues with
Long
that?
term, not really. Long-term use, maybe not. So obviously peppermint oil, fine. Long-term use, completely natural. Peppermint teas, things like that. And
peppermint tea to be in what form? Because some teas are better than others.
Yeah,
Is there a case of having fresh tea?
Ideally, ideally fresh mint tea. But if you've just got peppermint tea bags, that will also do the same job. You're fine. And you can just get peppermint oil drops if you want to. And Windy's is something you'd want to use occasionally, not because I know there's particularly bad side effects, but it's not something you want to be using necessarily every day. And with Buscopan, some people use it every day, but it is more of a pharmaceutical medication, so you probably want to have a little bit more of an awareness of that. And I think around this age group, really, I would say prevention is better than cure. So the other time I see lots of people is leaving home for the first time, going to uni, drinking lots, staying up late, really stressed and anxious, eating food that mum would never let them eat every night. And they end up in a situation where their microbiome is really compromised. And trying to prevent that is really helpful. So still trying to have a decent bowl of porridge maybe in the morning with lots of berries in it and maybe some nuts and things like that is going to help to support your gut microbiome through that difficult time. And then really investing in that stress management, taking care of yourself and finding ways to be calm and to find relaxation. And that's great if you have parents who are a good example of that, but lots of people's parents are equally as stressed and anxious all the time, and we need to find ways for ourselves that suit us as young adults that will carry us through for the rest of our lives.
Wow, so if we covered a whole load of areas, I could go on for hours with this. We should do another follow-up episode for sure. Absolutely. There's so much to dive into. It's been really fascinating. If people want to find you and come and see you and see your amazing team as well, where do they go to?
So the website is citydietitians.co.uk. So City Dietitians, all one word. If you Google my name, Sophie Medlin, you'll find my website, you'll find Instagram, all of those kinds of things. And I'm Sophie Dietitian on socials.
Great. Sophie, thanks for your time. It's been fascinating, and I'll have you definitely back in again really soon.
Pleasure. Thank you so much for having me.
Thank you for joining us today in the Evolution Lab. I hope you're able to take some great information and inspiration from our discussion. And while we love creating motivational and moving content for you, what I'd love for you to do now is take from today's episode what felt most relevant to you and apply it. And if you need help with that, or simply want to let me know what you thought of the show, please do reach out. You can connect with me and my team on social media simply by searching for my name or the handles at Matt Roberts Evolution or at Matt Roberts PT. Alternatively, head to my website, mattroberts.co.uk, where you can find out about the work we're doing at Evolution and get even more info about the show. If you found this episode valuable, I'd really appreciate it if you can take a moment to subscribe and let us know what you think about the show. Your support means we can reach even more people, change more lives, and reach even higher highs. Thank you so much again for taking the time to tune in today. Until next time, I'm Matt Roberts, and this has been the Evolution Lab.